Don Peckrell knows he's fortunate. He is surrounded by beauty, wildlife, and peace here at his Cape Cod home.
When they come back in the spring, they come back with their babies.
It's a peace that's not been shaken, even though Don is living with prostate cancer.
The only time I think about it is when I run into guys like 45 on and somehow it comes around to prostate cancer since so many people have it now. And I tell them, what my experience has been and that they should consider different options.
Instead of treating the cancer with surgery or seed implants, Don decided on an option called Watchful Waiting, now referred to as active surveillance.
As a surgeon who's done nearly 1,000 prostatectomies, I'm a real advocate for treatment when it's appropriate. And prostate cancer treatment is very effective. But on the other hand, it's a treatment course that does have potential side effects. And even just going through a treatment, even if there aren't long-term side effects, why go through a big operation or a long course of radiation or even a short course of radioactive seed implants if it's not really necessary?
Dr. Martin Sanda heads the Cancer Center's prostate program at Beth Israel Deaconess Medical Center in Boston. He's led dozens of clinical studies looking at various care options for men diagnosed with prostate cancer.
We found in a study that we just completed recently that about a third, between a quarter and a third of prostate cancers that are diagnosed nowadays actually fall in the category of being so early and slow growing that men should at least consider this option of deferring or delaying treatment, but monitoring it in the meantime, actively surveying it, actively monitoring it, and that's what active surveillance is about.
For most men, active surveillance could mean a PSA blood test every 6 months, an MRI once per year, and an occasional biopsy. And for some, it could mean a long stretch without treatment, or even no treatment at all. In fact, in a study of 3,300 men published in the Journal of Clinical Oncology, Dr. Sanda and colleagues found that just 1/2 of men with low-risk tumors under active surveillance had undergone treatment 10 to 15 years after diagnosis.
Very aggressive that way with these two.
It's been more than 2 years since Don's diagnosis, and he's glad to have chosen active surveillance.
My PSA has remained pretty much the same this spring and April. I had my second biopsy, and he called me and said things were fine. Things hadn't changed. In fact, seemed to him there were not even the presence there was before.
Another advantage, if he does end up needing treatment down the road, there may be even more options.
About every 5 years or so, a new treatment comes up, robot-assisted surgery or seed implant therapy, were not available 15 years ago. So we anticipate that some improvements like that may come into play.
I'm fortunate in a lot of ways. And I think if you end up obsessing on this bugaboo, this cancer word, that you have it, and it's easy, I think, to do that in this world, right? And it really is affecting your life, then it probably is a good idea to have it out. For whatever reasons, I'm not focused on that. I don't worry about it.
Don advises men who have had a prostate cancer diagnosis to find a support group in their area where they can talk to others, and a prostate cancer expert they feel comfortable with.
We talk to somebody who's respected and well-known in the field to clear up, because there's so much information out there. I hope men get tested earlier, and often, because clearly it's all around us.